Okay, guys, I'm back. This is part 2 of patient care for the LPN LVN student. This is a new series I'm doing. I actually, like I explained in the first video, I found questions online from the library. So I said, why not? Why don't I go over these type of questions? I asked you guys in the comment section, please let me know if this is something you're interested in, or if you hate it. If you hate it, I won't do it anymore. But the feedback I've gotten so far has been positive, so I decided to do a part 2. So please, in the comment section, let me know what you thought of this video. If you'd like to see more content of this kind, don't forget, you can follow me on TikTok, Instagram, Facebook, and of course, right here, YouTube. My handle's the same everywhere. Nexus Nursing, okay? Be sure to check out my website, Nexus Nursing Institute. You can sign up for Next Generation NCLEX review, one-on-one tutoring session. I can't speak. One-on-one tutoring session. And if you're a current student, you have an exam coming up that you really have to do well on, check out the audio lessons I have available for you. All right, guys, without any further ado, let's get started. So part 1, we did the first 10 questions. So this is part 2. We'll do the second set. So we're on number 11. It says, use the following to answer questions 11. All right. Mr. Martinez, a 58-year-old male with a history of CKD and hypertension who's admitted to the med-surg unit with complaints of weakness, confusion, and decreased urinary output. He has recently started a new antihypertensive medication, lisinopril. All right. Look at the vitals. Oh, this. Okay. Let's take a look at the labs. And orders. So administer furosemide 40 milligrams IV for potential fluid overload. Hold lisinopril, recheck blood pressure in 4 hours. Initiate continuous cardiac monitoring. So here's a question. It says the practical nurse in the med-surg unit is caring for a 58-year-old male client. Furosemides available in vials, with each vial containing 20 milligrams of furosemide. How many milliliters of furosemide should the nurse administer to meet the prescribed dosage? Okay. So there's 20 milligrams for every 1 milliliter, and our order is to give 40 milligrams. So this is really easy. If you have 20 milligrams for every 1 milliliter and you have to give 40, you're going to give double the amount. So instead of 1 milliliter, you're going to give what? 2 milliliters. Okay. And so it says the correct answer, the nurse should administer 2 mLs of furosemide to deliver the prescribed dosage of 40 milligrams. And again, remember, it was 20 milligrams per 1 ml. So if you're giving 40, you just do your 20 milligrams times 2. Okay. All right. You're going to give 2 mLs. Okay. So same patient is now 1,300 hours, and it says furosemide administered per orders. Mr. Martinez now experiencing sudden onset of severe shortness of breath, increased difficulty breathing, and audible wheezing. The question says the practical nurse in the medical surgical unit is caring for a 58-year-old male client. What's the most appropriate action for the nurse to take after administering the furosemide? A, continue to administer furosemide to address potential fluid overload. B, hold lisinopril and recheck blood pressure in 4 hours. C, initiate continuous cardiac monitoring. D, initiate interventions to address respiratory distress. I'll give you a second to think of your answer. And the correct answer is going to be D. And I'm going to explain to you why. It says that patients now experiencing sudden onset of severe shortness of breath, increased difficulty breathing, and audible wheezing. That's going to be our priority. Let me tell you something. This is a rule of thumb. Whenever something is actively happening with your patient right now, if it's for the bad, that's going to be your priority. Okay. So forget about that lisinopril. Okay. Forget about that cardiac monitoring. Yes, it's important, but we have to address what's happening to our patient right now. That patient can't breathe. Do we care about cardiac monitoring if they're dead because they weren't breathing? No, we don't. Do we care about that lisinopril if they're dead because they weren't breathing? No, we don't. So our focus right now is going to be what's wrong with that patient. They cannot breathe. That's going to be our focus. So we're going to make sure that we initiate interventions to help them breathe. That patient's in respiratory distress. Let me take a look at the vitals. Let me see what's going on, if anything's changed. 96%. Okay. All right. Moving on. It's now 1,300 hours. It says furosemide administered per orders. Mr. Martinez is now experiencing, okay, same thing, sudden onset of severe shortness of breath, increased difficulty breathing, and audible wheezing. So Mr. Martinez was given epinephrine and is now stable. What are the appropriate actions the practical nurse should take next? Select all that apply. All right, how do we treat select all that apply as true or false? So first one, administer another dose of furosemide to assess if the reaction was a one-time occurrence. Are you kidding me? So we're thinking that furosemide is what caused the allergic or anaphylactic reaction, because we had to give the patient epinephrine, right? Their airway was closing up on them. They were having, excuse me, a reaction, and we ended up having to give that patient epi. Do you think it's a good idea to go ahead and give them that same medication again to test the waters and see if that's really what caused the reaction? Absolutely not. Moving on. B, inform the primary healthcare provider about the allergic reaction. Absolutely. Whenever something wrong happens to your patient, if something's wrong, the first thing you're going to do is assess your patient. You're going to do nursing interventions. You're going to call the healthcare provider, let them know what happened, and also get any new orders. And the last thing you're going to do is document. Okay, patient always comes before paperwork, but absolutely, you're going to let the healthcare provider know what happened. C, document the incident thoroughly in Mr. Martinez's medical record. Absolutely. You're going to document the medication you gave, how much you gave, the patient's reaction, their vitals, because of course you're going to assess the patient afterwards. You're going to document all of that. Next, update Mr. Martinez's allergy list to include furosemide. Absolutely, because let me tell you something. Everyone else on the team needs to be aware. Next, discontinue lisinopril to prevent further adverse reactions. First of all, you can't step outside of your scope of practice, right? If it was the lisinopril that was causing a reaction, we would withhold the medication and call the healthcare provider, but you can't discontinue anything. You're not the subscriber here. So we're not going to choose that. And then F, withhold all medications until the healthcare provider is notified. Yes. We need to let the healthcare provider know what's going on and get other orders. Okay? Moving on. Okay, so same patient. It says the practical nurse in the medical surgical unit is caring for a 58-year-old male client. While the dressing is being changed on Mr. Martinez's peripheral IV catheter, he complains of pain at the IV site. Which action is appropriate in response to these findings? A, rotate the IV site regularly to reduce inflammation. B, apply a cold compress to the site to alleviate swelling. C, assess the IV site to check for signs of infection. D, increase the infusion rate to promote better circulation. What are you going to do? We're going to assess the IV site to check for signs of infection. Whenever something's wrong, this is the nursing process. The patient tells you something's wrong. What are you going to do? You're going to assess. You're either going to look at them, ask them questions, go in the patient's chart to get information, but guess what? You're going to do something that gets you information. Anything you do to garner information is considered an assessment. All right, moving on. The nurse is participating in the care of a client being admitted to the med-surg unit with a diagnosis of acute pyelonephritis. The nurse understands that which of the following nursing interventions is a priority while caring for this client. A, administering a sitz bath twice per day to the client. B, ensuring the client drinks cranberry juice to acidify the urine. C, increasing the client's fluid intake to 3 liters per day. D, inserting a urinary catheter to measure urine output accurately. Well, I should let you think about it first, but the correct answer is C. Listen. This patient has pyelonephritis. This is an upper urinary tract infection, okay? We expect to see generalized symptoms in the patient with pyelonephritis. Those kidneys are in trouble. Guess what? We don't want the kidneys to suffer anymore. So we want to flush the kidneys, because whenever you're dehydrated, the patient's not drinking enough fluids, it causes the kidneys to suffer. You're going to see the BUN go up. You're going to see the creatinine go up. So one of the most important things you can do for a patient who's having those type of issues is to increase fluid. You want to flush the kidneys. Administering a sitz bath, how is that going to help with the issues that the patient's having with that infection? It's not. B, ensuring the client drinks cranberry juice to acidify the urine. Cranberry juice, acidifying urine would have been great if a patient had a urinary tract infection, because we know bacteria doesn't like an acidic environment. They will not stick to the inner lining of the bladder in an acidic environment. So as soon as the patient urinates, those pathogens will exit the bladder. But we're not talking about a lower urinary tract infection, a bladder infection. That's not what we're talking about. We're talking about pyelonephritis. So that's wrong. And then the last choice, inserting a urinary catheter. Do you know one of the risk factors for the patient having a urinary tract infection is the presence of a urinary catheter? Anytime that you insert something into the orifice of a patient's body, there's a chance of introducing bacteria. You never want to do that. So the correct answer is C, you want to flush the kidneys. The nurse is assisting in the provision of education of nutrition education. I'm sorry, guys. I can't speak. Let me start over. The nurse is assisting in the provision of education of nutrition education for a group of pregnant women. The nurse knows that further teaching is indicated when one of the participants states that she will eliminate which of the following from her diet: A, alcohol; B, eggs; C, sushi; or D, unpasteurized juice. What do you guys think? Right. And the correct answer is eggs, because, oh, is that wrong? Let me read it again. The nurse knows that further teaching is indicated when one of the participants states she'll eliminate which. You're not supposed to have alcohol. You shouldn't have sushi. You shouldn't have unpasteurized juice. Oh, it is right. Sorry. Okay. It is right. So, this question's asking us for the wrong answer. Whenever you get a question asking you which one requires further teaching, which one would you ask for clarification, which one would you ask for follow-up, what they're really asking you is for the wrong answer choice. This woman's pregnant. Why would you say you're going to eliminate eggs? Eggs are a source of protein. Why would we eliminate eggs? What's wrong with that? But alcohol, are you supposed to be drinking alcohol when you're pregnant? No. Sushi, are you supposed to be eating raw fish when you're pregnant? No. You could have a pathogen introduced into your body, bacteria. That's not good for the fetus. And unpasteurized juice. Here's the thing. I don't know much about pasteurization and unpasteurization, but I am a big um network type of girl. I love crime shows. I love Discovery Channel, all of that. And one thing I do know, because I watched a show about how so many people in the city died from drinking unpasteurized juice, because when it's not the process of pasteurizing juice, I don't know exactly what it does, but it basically filters out certain bacteria and pathogens. And when the juice is not pasteurized, those pathogens can be in the juice. And then when you drink it, what happens is it goes straight to your brain. It could kill you, right? So someone who's pregnant, do you think they should take the chance of drinking unpasteurized juice and that pathogen or bacteria actually harming the fetus? No, right? So the only choice here that would make sense would be eggs. It doesn't say anything about raw eggs. It just says eggs. Eggs are a great source of protein. You'd follow up. Why would you eliminate eggs from your diet? The nurse is caring for a client with a stage 2 pressure ulcer of the left heel. It's most appropriate for the nurse to consult which of the following disciplines in the care of this client: A, nutritional support and orthotics; B, occupational therapy and infectious disease; C, plastic surgery and cardiology; or D, physical and respiratory therapy. I like this question because there's a couple things I want to talk to you about regarding this question. What do you think the answer is? There's only one answer. If this isn't the answer, I'm checking out. Okay, good. All right. So let's talk about it. Patient has a stage 2 ulcer. So, a stage 1, that's where the skin is still intact, right? It's still intact, but it's non-blanchable. All right. Now, the patient has a stage 2, so that skin is no longer intact, a stage 2 ulcer. Who would we get on the team? Which discipline? Well, of course, nutrition, because when it comes to pressure ulcers, what do we want to make sure the patient has in their diet? Protein. Why? Protein helps with wound healing. Vitamin C. Vitamin C helps with healing. What else? I'm missing one. Protein, vitamin C, pressure ulcers. Protein, vitamin C. Oh, calories. Duh. Why? Because calories give you energy for wound healing, right? So any patient who has pressure ulcer, you want them to have enough calories. And plus, you don't want them emaciated. If they're emaciated, that's more pressure that's going to be on the bony prominence, right? So you want them to have more calories, you want them to have more protein, and you definitely want them to have more vitamin C. So that's why nutritional support, and of course, orthotics, because where is this pressure ulcer? On the heel. So what kind of device or what type of shoe or what type of foam, what can we put on that foot, on that heel to alleviate the pressure? Occupational therapy and infectious disease. First of all, occupational therapy, that would be therapy for not below the belt, above the belt, excuse me. That would be therapy for above the belt. So if the patient has problems with their hands or their arms, they have problems zipping up their shirt or buttoning their clothes or combing their hair or brushing their teeth, things you do above the belt, that would be occupational therapy. Infectious disease, that would be for if the patient had a disease that was contagious, right? A pressure ulcer isn't something that's contagious. That's not infectious disease. Choice C, plastic surgery. This patient doesn't need plastic surgery, nothing wrong with their heart. And D, physical therapy. Physical therapy is for below the belt. If the patient has trouble walking, ambulating, respiratory therapy if something was going on with their lungs. So the correct answer for this type of patient would be nutritional support and orthotics. Oh, you guys, I'm not reading the rationales for the other choices because I tell you, but if you want me to actually click on the other rationales so you can see it, let me know. And in the next video, I'll do that for you. Okay. This question says, a 2-year-old boy is brought to the clinic for his well check. Click to highlight each statement by the mother that should be further investigated by the practical nurse. Again, whenever you have to further investigate, further question, get clarification, provide further teaching, really what you're looking for is the bad stuff, the things that are wrong. Okay, so I'm going to read this paragraph and we're going to try to find what's wrong. We're talking about a 2-year-old boy. He loves to play with his big sister. He's getting much better at crawling and can now keep up with her. They love to kick a ball back and forth, and he acts out the head, shoulders, knees, and toes dance when she sings to him. He doesn't really use a spoon yet or point to anything we ask him to except the animals in the books we read together. But he can say a few single words like ball, milk, and no. So we have to highlight everything that's incorrect, everything that needs to be investigated further. He loves to play with his big sister. Nothing wrong with that. He's getting much better at crawling. I'm highlighting that. You're 2. Why are you still crawling? You're supposed to, matter of fact, you're supposed to be running. Why are you crawling at 2? That's a problem. And can keep up with her. They love to kick a ball back and forth. He acts out the head, shoulders, knees, and toes dance when she sings to him. He doesn't really use a spoon yet. That's a problem. At 2, he should be able to hold that spoon by himself and feed himself. I mean, it's going to be messy him feeding himself, but he should be able to do that. So that's a problem. Or point to anything. Wait, he doesn't really use a spoon yet or point to anything we asked him to. That's a problem. He can say, what does that say? He can say a few single words like ball, milk, and no. That's a problem too. Why? At 2 years old, you should be using 2-word sentences, not just a few single words. You should be able to speak in sentences about 2 to 3-word sentences. So these three would be my issue. Let me make sure I'm not missing anything. Okay, I think that's it. Let's see. There we go. Let's see what the rationale says. Let me see if getting much better crawling, yes. Does it really use spoon? Yes. Singles. Okay, good. So the rationale says a 2-year-old child should be able to kick a ball and point two or more body parts. This is expected behavior. Children 2 years old should use a spoon independently, putting two or more words together. Yeah, basically. So that is what needs to be investigated further. I'm sorry, guys. It's lightning. I don't know if you guys can hear it through the recording, but it's raining so bad and it's lightning, thundering. Okay, the nurse is caring for a client with a spinal cord injury. The client is a tetraplegic. On the illustration below, identify the area of the spinal cord where the injury most likely occurred. 1, 2, 3, or 4. What do you guys think? All right, before I tell you what the answer is, would it help you if you knew this word tetraplegic is the same thing as a quadriplegic? I think it would. Okay. So the correct answer is 1. You expect that person to have a spinal cord injury because if they have a spinal cord injury, everything from that injury down, patient will experience paralysis. Okay. Tetraplegia, also known as quadriplegia, but we tend to see quadriplegia more. So if you're a new nursing student, you may have not known what that term was. All right, last question. The nurse is caring for a female client 3 days after total right hip replacement. The client asks the nurse why she must go to a rehab facility. Which of the following is the best response by the nurse? A, your physician wants you to go to the rehab center until you're able to care for yourself. B, the rehab staff can evaluate your progress and make sure that you exercise without risking injury. C, the rehab staff can provide you with better care than the hospital staff. D, you'll need help with your daily activities for quite some time. What do you think? The only correct answer here could be safety. The rehab staff can evaluate your progress and make sure that you exercise without risking injury. Okay. Let's talk about the wrong answer choice. Well, let me talk about the right answer choice first, and we'll get to the wrong answer choices. The correct answer, it's important that you go to rehab because these are professionals that can see if you are progressing in the amount of time that you should be progressing, how you're progressing, and they want to make sure you don't get injured during this progression. Look at the other choices. A, because the doctor wants you to do it. That is never a correct answer. You never tell a patient the reason they're doing something is because a healthcare provider wants it. Okay, maybe that would fly in the 80s or even the 70s, but not today. Absolutely not. C, the rehab staff can provide you with better care than the hospital staff. You're telling the patient, well, we suck, but these people we're sending you to are good. Are you kidding me? Absolutely not. Absolutely not. That's not a reason you'd be sending a patient to rehab. And then D, you'll need help with your daily activities for quite some time. That may be true. That patient may need help with daily activities, but guess what? That's why we have home health. If that was the case, we could have sent that patient home with a home health aide. That's not why we're sending that patient to rehab. We're sending that patient to rehab because of B. Now, before I let you go, let's talk about preventative measures, okay? Because we're talking about rehab. Rehab is a tertiary type of preventative measure. You have primary, you have secondary, and you have tertiary, and you are expected to know for both LPN and RN the difference. So primary, this is something like education or vaccines. In primary preventative measures, the patient doesn't have the disease or disorder yet, and you want to prevent them from having it. So that's why you provide education. That's why you give immunizations or vaccine. Secondary preventative measures, the patient might have it. We don't know if we have it, so we're going to test them to see if they have it. We want to see if they do have it, how bad it is. So a secondary preventative measure would be something like a biopsy, a mammogram, a colonoscopy. We don't know if they have it. We're going to test to see if they have it. And we're going to test to see if they do have it, how bad it is, right? Tertiary preventative measures, they already have it. We just want to prevent it from getting worse. So a patient who fell and broke their hip, we're going to send them to rehab for physical therapy so they don't get worse. So make sure you guys know the difference between primary, secondary, and tertiary. And guys, that's it. That is the end of the video. These videos, I'm going to do them in 10-question increments so they can be quick, fast videos to understand, and I'll be able to make more during the week. So please let me know in the comments section what you thought about this video. If you want more coming, because I do not want to waste my time. If you guys don't like it, I will completely stop. But if you enjoyed them, I'm going to keep going. And this is new. So if you have any suggestions, anything you think I should change or even add to the video, please just let me know in the comment section. Don't forget to check out my website. I've got lots of resources available to you, nexusnursinginstitute.com. If you enjoyed this video, you think what I bring to you is very helpful, be sure to check out that super thanks button on the bottom of my video. Thank you so much for watching, and you guys will catch me on the next video.